we had this great vision, and I think that was shared by the local health district broadly and also New South Wales Health Infrastructure to provide this one-stop shop for delivery of complex outpatient care. Really the key benefits are starting to combine the Specialist Medical Centre on site within the hospital itself, but we also have the benefits of bringing back on site our most senior doctors so that they're actually here within the hospital itself to manage patients if they become critically unwell.
There's enough room for people to sit without getting too close to each other in a pandemic. It's really important for us that we're now really close to the hospital wards, so if there is an emergency we can get down to our patients who are inpatients very quickly. Having all our outpatient services co-located here in the hospital will streamline things for patients, make it much easier for them to find what they're looking for. Honestly, it's like working in a big tertiary hospital in the city, and I think our patients deserve to have the same level of facilities that patients in Sydney have.
We had some elders come on board to talk about what was appropriate for our Indigenous patients. We had people in a patient user group. So we had people from all walks of life. It wasn't just staff, it was the community, and they were involved in this to make sure the person walking through the door is also getting what they want.
We have 32 consultation rooms which will meet the current and probably 10-year timescale of need. And that will also allow us to draw in training doctors, training registrars at both senior and more junior levels to assist with clinics, assist with patient care directly, and importantly for those training doctors, provide outpatient care experience and develop the skills that they'll need as they move forward as specialists.
As a trainee, our job straddles both inpatient and outpatient medicine, and we have to try to learn in both environments. I guess my first impression is that's just going to be so much easier when the clinics are right next door. Initially came out here because that's where my hospital rotated to, but I've kept coming back because I think the people who work here are brilliant, and I think it's a great cohesive medical team. I'm sure I'll come back again in the future because they now have a fantastic new hospital and outpatient facilities.
I'm the Senior Respiratory Scientist here at Dubbo Base Hospital, and I'm delighted to welcome you to our new fancy pulmonary function laboratory. It's twice as big as the area I had before, and because of that we've been able to expand our portfolio of tests that are available to the people here in the Central West.
This facility is phenomenal. It's beautiful, it's bright, it's new, and there's so many different things we can do here now. Imagine coming into town and going to one place and being able to do 4 or 5 appointments. Amazing. We're going to have our staff all together. Everybody is going to be in the one place, and that is exactly what we need here in Dubbo.
Personally, I'm super excited to be working in this lovely new building. We've been waiting a long time for it to come, and I'm really happy that my tax dollars are being spent on a beautiful hospital like this for my community.